There is a significant amount of consternation in the United States as to whether or not schools should reopen in the fall. The president is pushing hard to try and make this happen. Are you with him? Do you think the scientific community is with him? How do you see this debate shaking out?
So I sort of separate what the president is saying from actually what the science is. And it just so happens that maybe scientists agree with the president on this, probably for different reasons. So it's a little bit more complicated than that. But what we know about children is we know they get infected, but they don't seem to be major epidemiological drivers of infection. They're not causing outbreaks to occur, which is very different than influenza. And children tend to have very mild illness. And we know that countries like Denmark and Finland have opened schools without problems. And we've had daycare centers open for essential workers throughout the pandemic. So there's a lot of data that we can use to open schools and make them safer, make sure that we're protecting vulnerable populations like the teachers that might be there, and modify operations. So I do think this should be a priority. We know that children not being in school is actually harming them, and we want to get schools back open. We want schools to follow CDC guidance, though. We don't want to throw out the guidance and just open them without any kind of consideration of what may happen. But I do think that this should be a priority for the country.
Oh, yeah. I mean, literally ask any parent, myself included, and everyone thinks the schools should be open. It's not a matter of if they should be, but I guess how. Not necessarily when, but how. So if you were writing a prescription for, say, a public school in New York City, what would be the safest way for my 5-year-old daughter to go back to a first grade class where there are 28 to 30 kids?
You want to make sure that the children can do social distancing. So you need to have decrease the capacity of classrooms, and that may involve some innovative thinking using alternative spaces for classrooms. You may want to limit the interactions in places like cafeterias and playgrounds. You might want children to kind of be in blocks together so that they're not mixing as much. You want to make sure vulnerable teachers have the appropriate personal protective equipment that they may need to teach adequately. You want to still be flexible if people who don't feel safe, that they can use electronic means and distance learning and conference calls to be able to do their work. You want to think also about doing as much outdoors as you can do outdoors while the weather permits, in places where weather permits. And you want to really encourage hand hygiene. Likely children will be wearing face shields when they go to school. All of that is part of the plan. And I think there's room for variation depending upon the school district and the logistics in each place. But I think that those are the general principles I would put into place.
Let's turn our attention to what is happening in hospitals right now, Dr. Adalja. We are continuing to see the case count climb, but we are seeing the mortality rate go down. Are we going to get to a point where hospitals are overwhelmed, and at that point, does the mortality line start to go up again?
That's the real fear that we have in certain states like Arizona, Texas, and Florida. We know right now that mostly younger people are getting infected, but clearly that's not always the case when you see hospital records rising. Hospital rates rise in certain states and ICU bed utilization go up. But you have to remember that deaths lag, so it takes some time for people to get sick enough to die from this. And we do have some factors that modulate our deaths, meaning we've got a lot more knowledge about this virus. We understand its complications better and know how to prevent those complications. We're much better with mechanical ventilators, how to use them. We have some tools like remdesivir as well as steroids that may have a benefit in certain populations of patients. And we know, for example, that we're much better at dealing with our nursing homes than we were early on. Early on, we had governors in New York and Pennsylvania forcing nursing homes to take patients with COVID, and that basically led to the virus spreading like wildfire. And over about 40% of our deaths in the United States came from nursing homes. So if we can keep the young people from infecting nursing home patients, vulnerable patients, we may see some modulation of deaths, but we have to expect, just based on ICU numbers, that we are going to see deaths increase in the United States. But hopefully it will be manageable and hospitals will not go into crisis.
So just to that point, the latest data coming out, so Florida COVID cases actually rose 4%. That's less than the 7-day average of 5%, but deaths did rise by 120 versus yesterday they were at 48. This is a really sensitive question. I don't know if I'm going to ask it right, but what's a tolerable amount of deaths?
I don't think that there's an answer to this. I think it's important, though, that people realize that this virus is with us until we have a vaccine. This has established itself in the human population, and we are going to get cases and hospitalizations and deaths. There's not much we can do about this. What we have to really do is focus on keeping those vulnerable populations as safe as possible by fortifying our nursing homes, really public health messaging to them about the importance of social distancing, and being very aggressive with treatment when they get sick, making sure they're recognized, diagnosed, And all of this is kind of the basics of public health, trying to protect the vulnerable population from infection. And it's going to be difficult because we know that the solution isn't to keep the economy shut down, but there has to be a way to try and balance this and really think about a way forward while we protect those vulnerable populations. And I do think that there is going to be inevitable number of deaths, and I think that people have to really acclimatize themselves to that.
Fortifying our care homes. It's a strange world we now live in. Dr. Adalja, final quick question from me. We're trying to understand how we get people back inside. New York's going to have a rainstorm this weekend. We're going to see people, therefore, not able to eat out on the streets. It's going to get cold at some point. People aren't going to be able to eat out on the streets. Are we starting to get an understanding of how we create an environment inside that replicates outside, that allows people to eat and drink inside, maybe with higher levels of ventilation, maybe UV lights or whatever it is, that is going to be able to, for us to be able to take our lives back inside again once the summer is over?
It's going to be very challenging because we're sort of relying on the fact that the virus transmits less efficiently outdoors to kind of get us through this. But we do have to think about our indoor spaces and redesigning them in a way that decreases the spread. So that could include increasing ventilation. You may see, for example, in bars in Japan, people are wearing face shields and drinking their drinks out of straws. That may be another way that we can think about doing this. I do think that there are solutions to this, but you have to remember that no activity is going to be without risk, and we're not going to be able to eliminate the risk completely. It's just that we have to be able to keep the pace of cases to a level that's manageable by our health department contact tracing team so they don't lead to chains of transmission that spill into hospitals.